This is Gary Atensi with CNTV, and today we're in Cherry Creek. I am here at Well M.D. Since 2014, they have been providing hormone replacement therapy for men and women here in Cherry Creek, as well as the entire city of Denver. I'm here with Hope, who is the medical director, doctor in charge, lead, quite a few titles under one roof here. Let's start a little bit about yourself. Hope, share with us how it is you got involved in this particular type of industry.
I think it was a combination of both personal and professional change. After being in an operating room as a board-certified anesthesiologist for over 32 years, I have seen more and more of my patients coming into the operating room younger and younger, and yet more and more unhealthy. And then personally, what happened to me several years ago is my father, despite having a very good workup for more life insurance at age 70, ended up having a horrific episode of, let's say, sudden cardiac death. So with a family history of heart disease, for me, that did not bode well, and so began the journey of looking for other ways to optimize my own health and wellness. So that's how Age Well began.
That is a great story. Let's start off first of all. Let's educate the viewers a little bit. First of all, what are hormones? We're talking about basically a chemical messenger that is traveling through our body, and what is it doing exactly?
Essentially, for our bodies, we need our organs to be able to talk to each other. And what has evolved over time is that hormones, as chemical messengers, allow each organ to talk to the other organs. So it's a different concept of how we in Western medicine think of organs as these separate entities. No, they work together almost like a symphony orchestra.
We're talking about some very coordinated, complex processes going on, obviously affecting things like metabolism, fertility, even growth, even before we're born, goes into play here. Is that right?
That's exactly right. And I think it is important to realize that hormone imbalances can happen at any age. It's not something that is a problem of older people, aging people. We're now seeing hormone imbalances and loss of optimal hormone function, even in young adults, children, and that was always a huge surprise for me, because I always thought that when we look at younger people, we think they're too young to have this problem, and that's totally incorrect.
Totally incorrect. Not only that, but we're talking about, like you say, we think of menopause, we think of older lady, yet this can happen anytime through our life. Not only that, but women and men as well.
That's correct. I think what we've seen over the years is, with studies throughout the world, women start losing their hormones at very young age, even in the late 20s, early 30s, and finally they start losing estrogen in their 40s. And of course, then we end up in the state of menopause. For men, actually, the state is called andropause, the loss of testicular hormones.
Wonderful. Let's talk to us a little bit about what signs, what are some of the symptoms people are coming through the doors and maybe realizing they need to take a look at this.
Well, I think for a lot of people, the surprise is that it has nothing to do with libido. What ends up starting out with most people is fatigue, insomnia, inability to focus, brain fog, inability to manage their weight. And for some people, that's not managing weight to lessen it, but also to put weight on. So it's a combination of a lot of factors that, once again, has nothing to do with libido.
Yes, that's the one we're all very common with. We know about the 3 sex hormones, but yet there's 47 other hormones, probably not too often talked about.
That's correct. I think, once again, when we think about our hormones as chemical messengers, they function together like, as I've been taught, a symphony orchestra, and that at times we do need certain organs and hormones to be more loud than others, but certainly they function best when they're in harmony.
muscle growth, heart rate, like you said, even hunger. These are all things that sound very, very serious. So I imagine the side effects and symptoms that people start realizing probably can get them in a little kind of a state of overwhelm, I would imagine.
Oh, that's true. And the big problem that people start to feel and experience is when they have one hormone system that is out of balance and that it even impacts the other systems. So it's more complex than we tend to initially believe.
So we're really losing hormones, especially, like you say, women, even age 20 to 40, there's a certain percentage that they're losing. Is this have to do with diet? Does it have to do with our society more? Is that why we see it more, or not really?
I think it's a combination of yes to all of those things. When we think about it, truly our soil is depleted, our food, the nutritional status that we live under is not very good. We live in a different world than when our grandparents were growing up in a more agrarian society, living on the farm where they truly, everything was organic, even their animals that they slaughtered. Certainly the plants were all organic. Now, even though we have so many organically labeled foods, the nutritional status is not quite good enough. Also, who knows what's in the air we're breathing, the water we're drinking, and then the overall stress and pace of life that people actually now have accepted as being the new normal.
When someone is having some of these symptoms, they go to their practitioner. Many times, can it happen they're misdiagnosed, basically sent out the door for totally something different? I mean, why is it very important and even safe to have basically a focused lab work done to make sure that they are understanding what their body's going through?
Well, I think it's become more complex, and as we go back to that, we're having younger and younger people coming in and complaining about having irritability, inability to focus, inability to sleep, and oftentimes my colleagues in primary care don't have all of the time to sit and listen to all of the complaints at one sitting, and that their focus is on disease management oftentimes and not necessarily preventive health care.
Interesting. Obviously, as we move through the 21st century, one of the things that we learn even more, even in the Western world here, is that there is a natural way to help our body. Talk a little bit about the synthetic hormone versus that of what you offer, which is the bioidentical.
We've done in Western medicine a disservice to not just ourselves as physicians and other healthcare providers, but also to the population in general by thinking all hormones are created equally. And actually, when we think about synthetic hormones, they are biochemically different than our normal human hormones. And synthetic hormones historically have come from such things as the term Premarin, which is an estrogen, stands for pregnant mare's urine. So that's certainly not biochemically the same as human hormones. And certainly the bioidentical hormones come from a plant-based substrate from either yams or from soy, and they look identical to our human hormones. So we have to get substrate from somewhere. So that's where this comes from.
That is amazing. When we're looking at synthetic hormones, is the issue many times really the absorption that we're able to handle, our body can handle them or not?
Absorption is a big component. The way hormones have historically been given is orally, but oftentimes what happens then is that the hormones are absorbed through the intestinal tract. They immediately go to the liver, and the liver, let's say, refigures them, turns them into substances that are not necessarily healthy for us, versus bioidentical hormones can be absorbed through the skin, through the oral mucosa in the mouth, even through the mucosa of the vagina or rectum, and then of course there's pellets that are placed subcutaneously that are absorbed.
So we're not talking about an oral absorption here. We've got many different ways to go through the therapy. What is the most efficient that you see happening here in the office?
What we're seeing here in the office, number one, is to respect everybody handles hormones differently. But what we do see statistically is that hormones that are given, administered through the skin, up to 45% of the population, both men and women, don't absorb through the skin, even if it's a gel or a cream base. Some hormones work best when they're given subcutaneously, such as testosterone, estrogen, through pelleting, which is given over a period of time, one dosing. And then that's repeated for women every 2.5 to 3 months, and for men every 4.5 to 6 months. So it's a variable, and it's an individualized type of treatment. Almost analogy as being in the operating room. How much does it take to put somebody to sleep? And my answer is always the same: enough.
Just enough. Wonderful. Bioidentical. When people actually receive this therapy, many times they have side effects that are sometimes beneficial side effects. Actually, they find that it's helping other parts of their lives. Can you share with us a little bit how it affects the parts of the body that maybe they didn't even plan on or anticipate?
Certainly. I think some of the important things we think of, say, for instance, testosterone. Everyone, the joke is, thinks of sex, drugs, and rock and roll, when truly testosterone is helpful for bone health, muscle health, cardiac health, and the biggie right now, we're seeing it as brain health. So all of these things have nothing to do with libido, but also are very important with total body optimal wellness.
Wonderful. I mean, we probably have viewers out there basically that possibly they're going through something like this for the first time, or maybe they've gone somewhere else, they've tried other therapies. Either way, basically they can come in with a feeling of kind of helplessness. Is what you've created here a place that really can educate people and really provide a competent staff, at the same time being compassionate with folks?
Certainly. I think what's important for people to realize is that overall, that each person interacts with me, and it's a one-on-one relationship that we will work together over a period of time to get them truly in what is their individual optimal wellness. And that it can take some time for some people to, let's say, get there on their journey. I use the analogy that I say I'm bringing them up from the subterranean basement of an apartment building, and I'm trying to take them up to the penthouse. And then I wish that we could always ride that express private elevator, but I swear some people want or need to stop at every floor and visit it on their way up to improvement in their health.
But obviously that starting point is a consultation on the front end, where basically it's one-on-one. You understand what they're looking for, and you're putting together a program for that. Are they happy to have that time with a doctor, basically, with it wants to understand, and it's not a quick, one size fits all, but really a customized approach?
It is a customized approach, and I think what's important for people to know about, and what my patients are saying now, is that I hear the common statements over and over again is, number one, no one ever looked at me this way. No one's ever tested me this way. And this is a huge thing. No one has ever explained these problems to me in a way that the patient can understand. Because my overall goal is that it's not so much of a monologue or a matriarch care plan for the patient, but it ends up becoming a dialogue where the patient is telling me how they're feeling, how they're doing, what we can do to modify their care, because each person, let's face it, is different, and their priorities are different.
Wonderful. Viewers, take a look at the bottom of the screen right there. What you're going to see basically is their contact information. You can check out their website, understand a little bit more about hormones in general. They've got a great educational pieces on there as far as Hormones 101. You can contact them, set up a consultation for yourself, and find out if this is something you can be helped with. Basically, you're providing an integrative medical practice that is very heavily emphasized on preventive care, which is different from probably what you did in the surgeon room? Is it something that is rewarding for you and that you enjoy?
Well, I think what's been very wonderful is the feedback from my patients saying, "You've given me my life back, thank you. You've saved my marriage, thank you. I now have the strength to make the change in my career, my job. I like my kids now." All of those things are so important to improve someone's life journey. And I think what's really important for all people to realize is that as we go through the aging process, Western medicine and my career in anesthesiology has done such a wonderful job of keeping us alive, but we're no longer should be defined by our chronological age. We should be saying, I may not have yet experienced the most important thing I should be doing in my life, but I need to be awake, I need to be focused, I need to be healthy in order to be aware when that opportunity comes around. And I think for myself, for over 30 years, I have focused on putting you to sleep. And now I've turned 180 degrees and I'm focused on awakening you. So
That is a wonderful
that's cool.
story. Viewers, last time, take a look at the bottom of the screen right there. You're going to see their contact information. They're located right here in Cherry Creek, basically serving the entire city of Denver, the state of Colorado. That is Age Well M.D., living life in balance through inner and outer wellness. This is Gary Atensi with CNTV, and if you don't know, now you know.